Transplantation is a lifeline for patients with kidney failure. It's not the only life-preserving treatment. There is also dialysis. But even among patients undergoing dialysis treatment, kidney failure is deadly. Within 1 year of the diagnosis, 20% of these patients have died. Within 3 years, that's 40%. Within 5 years, 60% have died.
Kidney transplant offers a longer life and better quality of life. So people are better able to engage in their daily activities. They have fewer limitations. They're more likely to be able to retain their job than they are if they're on dialysis full-time. And they tend to have less medical complications than patients who are on dialysis.
TREAT stands for the Transplant Research for Enhancing Access team. We're a group of clinicians, researchers, and patient advocates dedicated towards improving the process of receiving a transplant for patients. When we talk about access to transplant, we're not just talking about the day of surgery. We're talking about patients navigating a really complex process.
We think of the transplant access as a roadmap, and there are numerous steps that patients have to go through to ultimately get a transplant.
Patients with end-stage kidney disease, they're getting in the car. The referral to a transplant center tells them where their destination is. In order to get to the transplant center, they need to navigate a very complex medical and psychosocial evaluation that involves many doctor's appointments and many specialists. Once they get there, the transplant center decides whether or not they're going to be selected for listing. And after that, patients need to either wait for a deceased donor organ or find a living donor. So we consider navigating all parts of that process to be a part of accessing a transplant.
As we always know, patients are getting lost along the way to the kidney transplant. Previously, we don't know where and why. With the data collection, now we can see where the clogs are in the health system, and now we can help improve that.
Transplant not only increases a patient's chance of survival by as much as 80% compared to dialysis, transplant also improves patients' quality of life because they don't have to be in a dialysis unit receiving treatment for 12 hours every week. To get a patient to that point, though, we need to have a well-orchestrated system where all parties in the healthcare system and patient social supports are working together to help patients get through every step of the transplant care pathway.